be discovered so that we do not have to reach the stage where we must go to the teaching hospital and have all the expensive treatment. The aim is to decrease the number of people that must require extensive and expensive treatment. And this is one of the kind of places to catch them early through screening.
This new structure?
Yeah, this new structure incorporates screening for the commonest cancers that are bedeviling our population, that is breast cancer, cervical cancer, and prostate cancer in men, because these are the commonest cancers for now that are of deep concern to the nation. And therefore, a lot of effort has gone into play in order that we could provide for the early detection of this kind of cancers. Because if left not detected, they tend to tell a lot on the services, because you must now have to use very expensive modalities of treatment which are not good for the socio-economic well-being of any nation.
But, Your Excellency, the Governor of ZAMFARA State, my colleagues, the Minister of Works and Minister of Environment, and the representative of the Minister of Health, the CMD management and staff of Federal Medical Center Gusau, distinguished ladies and gentlemen. Because our time is very short, I thought this is the best time to make the comment I will make. After the inspection, maybe journalists will have a question or two and then we'll leave. We are not going to spend more than additional 10-15 minutes here. Your Excellency, let me on behalf of the President and the federal government say this to the people of ZAMFARA State. You will notice that in the last 2 years there has been an aggressive expansion of our health program in the country. What the federal government has done in the last 2 years is to lift the capacity of our teaching hospitals phase by phase to a level where most of the difficult medical cases that take people abroad are treated within. That program is taking hospitals in phases, teaching hospitals to equip them, give them scanning, MRI scanning, all of them are being provided. When we went to University Teaching Hospital Benin, we had a whole facility for bone marrow transplant. It's the first center of its type in this part in West Africa. Yes, bone marrow. You can take children with sickle cell and they will change their bone marrow and they will grow up as normal adults. That is already being operational in the University of Benin. At Irua, we have the first center for screening and treating Lassa fever. Screening center is at Irua Teaching Hospital. Now, as we went around the country, we are telling Nigerians that most of the, please can we have some silence from the media? Most of the cases that are taking people to India, taking people to Egypt and other places, we have them in this country now. We have them. And I think people should make inquiries. What we have asked teaching hospitals to do is to advertise, not the doctors. You know, in the medical profession, you can't advertise professionals. But we can let people know the services that we are rendering. This will help. Teaching Hospital Enugu is now resuming open heart surgery. It has started back again, so people don't need to go abroad for open heart surgeries. These are now taking place here in Nigeria. At the teaching hospital in Delta, hip bone surgery and transplants are taking place. And this is done by Nigerian professionals, some of them from diaspora, who are now coming home because of the increase in medical services that the federal government is doing. Now, this is a whole new complex that the federal government has built for the medical center in Gusau. It's just new, and I understand that we have not completely actually packed in here yet. This is just being delivered by the federal government. And the medical centers across the country are being given additional facilities. This is a cancer screening center, like I say, even in Kefi and several other places, we are having them. The idea is to upgrade the capacity of medical centers almost to the level where if you don't have a teaching hospital available, they can give you adequate care, unless something really beyond them, because we also have a lot of consultants that do the same thing that you have in teaching hospitals. Now, this is for the people of Zamfara State, because wherever we have these centers is for the people there. I want to thank the governor for the cooperation, because I know since 1999 we have been staying in a facility provided by Zamfara State government. And even now I know that that cooperation and support has not stopped, because this hospital will continue to need the support of Zamfara State government, as well as what the federal government is already doing. And even good people who can sometimes give equipment, you know, to hospitals to assist and support. So with this, I believe that medical services in Zamfara will be highly upgraded with what we have here in Gusau now. So you have space, you have additional facilities, and what is required therefore is for management to work, you know, round the clock to give people the best. So on behalf of the President and the Federal Ministry of Health, I also want to congratulate the CMD and management of staff for supervising these projects to this level of completion. We thank you very much indeed for your attention.
Where we spin our samples, and there is incubator here. Yes, that is why we incubate our samples, and this is the macroplate reader where we.
So, Your Excellency, the ministers and the other all protocol duly observed. So what you are seeing here is the ultrasound room. We have basically two ultrasound machines, a 2D ultrasound machine here to support cancer screening. It could screen for any part of the body, from abdomen, either in the tummy, in the head, in the eye. The other machine you see here, that's about the third we only have in the northern Nigeria. It's a 3D, 4D ultrasound machine that the center has that can support and have a high diagnostic value and rate. Thank you very much, sir.
Good morning, you're welcome to the mammography room. This is the mammography equipment. Mammography is a general examination of the female breast, and it's usually done as part of screening in breast cancer. Breast cancer is the leading cause of death in most women. So the patient comes in and then is positioned in this. The equipment is actually state of the art and it's very user friendly. So the patient comes in and the breast is placed on the plate and then is compressed so that the radiographer can easily leave the patient here and goes over to the operation console to make exposures reduced. Then the radiologist reads through the image and then a diagnosis is made to either detect the presence or absence of a cancer cell. So that's basically the mammography process. Thank you, sir.
Gusau started in 1999.
Can you guys move back so that? Okay, you know what we'll do? You guys come this way. Boss, you drive away now.
First you? Yes. Okay. Your Excellency, Honorable Ministers, gentlemen, Federal Medical from this noble project, Cancer Screening Center, is one of the 4 centers we have in, or 6 centers, one of the 6 centers we have in the country. This particular cancer screening center